We'll start with the pectoral muscles, beginning with the pectoralis major. This muscle inserts along the humerus and originates from the sternum as well as the clavicle. Just deep to that, we have the pectoralis minor muscle, which originates from along the ribs and inserts along the scapula. Next, we see the deltoid muscle, which originates from the clavicle as well as the spine of the scapula and inserts along the shaft of the humerus. These muscles function to manipulate both the arm as well as the scapula. Reflecting both the pectoral muscles and looking at the axillar region, we see the anterior cords of the brachial plexus, as well as the branches off of those two anterior cords. And then behind the axillary artery, we see the posterior cord and the branches coming off the posterior cord. We'll talk about those branches in more detail in a minute. And remember that the two anterior cords are anterior to the axillary artery, shown here, and that the posterior cord is posterior to the axillary artery. Next, we'll take a closer look at the medial cord, as well as the lateral cord, and the branches coming off of both of these cords. Starting with the medialmost branch, the ulnar nerve, the middle branch, the median nerve, and the lateral branch, the musculocutaneous nerve. Here we see the axillary artery once again, just behind the two anterior cords. And behind that, we see the subscapular artery going into the subscapularis muscle. That's the second branch off of the axillary artery. The first is the thoracoacromial artery, which feeds into the pectoral muscles. And behind the axillary artery, we see the posterior cord. In the first branch off the posterior cord, we see the axillary nerve. Beyond that, the posterior cord becomes the radial nerve in the upper arm. Here we see the medial pectoral nerve, which feeds through the pectoralis minor muscle. And then we have the lateral pectoral nerve coming off the lateral cord, feeding into the pectoralis major. Again, here we see the ulnar nerve, and in the middle, the median nerve, and the musculocutaneous nerve on the lateral side. If we zoom in here, we can see the branches off the musculocutaneous nerve feeding into the biceps brachii and coracobrachialis muscles. Just deep to those three nerves, we see the brachial artery. Remember that the brachial artery is simply a continuation of the axillary artery as we move into the brachium or upper arm. Continuing down the arm to the antecubital fossa, we can see where the brachial artery splits into the radial and ulnar arteries. The more superficial branch here is the radial artery, and behind that, moving deep, is the ulnar artery. We will continue with those later in the segment. Next, we will examine the muscles of the brachium, starting with the biceps brachii muscle right here, the origin of which of both the long head and short head are on the scapula, and the insertion is along the radius. Just deep to the biceps brachii, we have the coracobrachialis muscle, which originates from the scapula and inserts on the upper portion of the humerus. The biceps brachii muscle flexes the arm and forearm as well as aids in supination, whereas the coracobrachialis raises and adducts the arm. Next, we see the brachialis muscle, which originates midway down the humerus and inserts on the ulna and flexes the forearm. On the posterior side of the brachium, we see the triceps brachii muscle, which originates from the scapula as well as the humerus and inserts on the olecranon process of the ulna. Moving along into the posterior side of the antebrachium, we'll begin with the superficial extensor muscles, which originate from the lateral condyle of the humerus, in contrast with the deeper muscles, which originate from either the radius or ulna. First, we see the extensor digitorum muscle, which extends the digits. Next, we see the extensor digiti minimi muscle, which of course inserts on the littlest finger. On the ulna side, we see the extensor carpi ulnaris muscle. This muscle inserts on the base of the fifth metacarpal. Moving to the opposite side of the extensor digitorum, we see the extensor carpi radialis longus, and deep to that, the extensor carpi radialis brevis, which insert at the base of the second and third metacarpal, respectively. Next, we see the abductor pollicis longus, and just distal to that, the extensor pollicis brevis, both of which insert on the pollex and help with abduction and extension of the pollex, respectively. Next, to find the deep muscles of the posterior arm, the posterior forearm, we look underneath the extensor digitorum muscle. Here we see the extensor indicis, which functions to extend the index finger. And moving toward the pollex, we see the extensor pollicis longus, which, like the pollicis brevis, extends the pollex. Next, we will examine the muscles of the anterior forearm. All of the muscles in this group originate from the medial condyle of the humerus, except for the brachioradialis, which originates from the humerus, and a couple of the deeper muscles, which originate from either the ulna or radius. All of the muscles in this group function to flex either the hand or the digits, as well as aid in pronation. We will begin with the brachioradialis muscle, which inserts on the styloid process of the radius. Moving across, next we see the flexor carpi radialis. This muscle inserts on the base of the second metacarpal. Here the pronator teres inserts on the shaft of the radius. Moving toward the ulna, we see the palmaris longus. And then finally, the flexor carpi ulnaris, which inserts on the pisiform bone and fifth metacarpal. Moving just deep to those three muscles, we see the flexor digitorum superficialis. Like all digitorum muscles, it inserts on each digit and functions to flex the proximal and middle phalanges of each digit. Deep to the flexor digitorum superficialis on the ulna side is the flexor digitorum profundus, which inserts again on each digit but functions to flex the distal phalanges of each digit. Adjacent to the flexor digitorum profundus on the radial side is the flexor pollicis longus muscle, which of course flexes the pollex. Deep to the flexor digitorum profundus and flexor pollicis longus is the pronator quadratus, which inserts on the radius and originates from the ulna. This muscle functions to pronate the forearm. Finally, we'll finish with the vasculature and nerves in the antebrachium, starting with the median nerve here, which remember runs through the carpal tunnel. Next, we see the radial artery and nerve, starting with the artery here. And adjacent to that, we see the radial nerve, which remember is a continuation of the posterior cord of the brachial plexus. Again, the radial artery, which branched off of the brachial artery. On the opposite side here, we can see the ulnar nerve, which is cut. Running parallel with the ulnar nerve is the ulnar artery, shown here, which remember is the deep branch off of the brachial artery.